Hi, I'm Tim Pflederer. I'm Chief Medical Officer for Evergreen Nephrology, and I'm a nephrologist. Now, that's a great question, Luke. Uh, there was a study published in New England Journal of Medicine actually this month that showed that the prevalence of CKD has not changed over the last 2 decades, but the diabetes and heart failure are increasingly associated with CKD. So we know that as nephrologists and providers that CKD doesn't travel alone. It's a syndrome with heart failure and diabetes and obesity. And SGLT2 inhibitors and GLP-1 agonists treat all of those conditions. They're beneficial for all of those conditions. So they've really revolutionized our thinking in terms of just chronic kidney disease, but rather a cardiovascular metabolic kidney syndrome. Well, most patients with CKD are going to benefit from these therapies. So, chronic kidney disease patients who have proteinuria absolutely benefit. Chronic kidney disease patients with diabetes or heart failure also benefit. So, it's no longer just the chronic kidney disease patient with diabetes, but it's really the patient who's at risk of progression of kidney disease, who's at risk of cardiovascular events, or who has diabetes, because these agents both really have benefit in all of those areas. I think most importantly for providers, we want to think about with an SGLT2 inhibitor, as you're starting that therapy, you want the diabetes under control because those work by causing sugar to go out into the urine. And so if a patient's diabetes is out of control, then they will have a lot more urination and could get dehydrated. GLP-1 agonists, those actually starting low and starting slow is important so that patients don't have GI intolerance, because both of those things will cause patients to start a therapy and stop it, and then they don't get the benefit. So it's always important that the patient understands the purpose of their medication and the adverse event profile. So with SGLT2 inhibitors, they are going to urinate more. They need to be alert for urinary tract infections, particularly in women, and report any symptoms of those relatively quickly. And then they also need to just understand that if they get sick because the SGLT2 inhibitor causes them to urinate more, they should contact their doctor so that if they're not able to keep up with fluid intake, that they probably will have that medication held until they're better and they're drinking more normally. With a GLP-1, it's really important to counsel patients that they will experience some gastrointestinal side effects, and that those diminish over time, and just to stay in contact with the physician or the provider so that they can ease into those medications and and adjust and then stay on them and get the benefit.